Here are a couple of more blood smears. Here's a normal one on the bottom, and here's a disease on the top. And you can obviously see the difference and make the diagnosis, so let's move on to the next case. Just kidding again. Let's click the normal one on the bottom once, twice, 3, 4, 5 times. Once again, we could see the ratio between these nucleated white cells and the non-nucleated red cells. It looks like they are just a very, very small fraction of the total cells, perhaps 1%, 0.1%. Let's click on the blood film in the patient with the unknown disease. 1, 2, 3, 4, 5. It looks like there's about 10 times as many white cells. We don't know what kind they are yet, but if a normal white count is, let's say, 6 to 10,000, would you believe something like this might be perhaps 60 to 100,000? Because it looks like there's 10 times as many white cells here. What could this be? What could the cells be? Well, before we decide what it is, let's notice something. Do you see these little guys here? These are platelets. 1, 2, 3, 4, 5, 6. They're all over the place. In the cell on the top, I can only see 1, 2, 3, 4. I really don't see any more. So first of all, these platelets are greatly reduced. Secondly, the cells that seem to be proliferating, which are the majority of the cells, have two features. Number one, they all have at least one nucleolus. Now, in this type of stain, the nucleolus is lighter than the rest of the nucleus. This is a Wright or a Giemsa type of stain, so the nucleoli are lighter. Here's at least 2 of them here. Here's probably 1 here. And notice they are very huge cells, and notice they really don't have any differentiation in their cytoplasm. Here's one with very minimal and undifferentiated cytoplasm, 2 nucleoli. Here's one with 1 nice nucleolus. Here's one with a couple and very minimal cytoplasm. These are blast cells. Normally, the number of blasts you should have in a peripheral smear should be about 0%. Whenever you have more than 1 or 2, or in this case, it looks like 90% of them are blasts, you can diagnose acute leukemia. Acute leukemias are also associated with anemia and thrombocytopenia as well, because the marrow is predominantly producing these blast cells. Let's take a look at an interesting gross picture associated with this case as well. It's a bone. Now, as you know, or maybe don't, in an adult, the hematopoietic bone marrow should not extend much beyond the very, very proximal portions of the femur. If a marrow is expanded, perhaps due to leukemia, the marrow might involve the whole bone. Normal adult bone marrow in long bones is 100% fat. In here, you can see this is not fat at all. This looks like red hematopoietic marrow. But in this case, it's producing mostly the blast cells and has a relative suppression of the platelets and white cells. And thank you very much.